Okay, we're going to go ahead and get started for the next session. Dr. Rush is going to be presenting on managing the emotional highs and lows of Parkinson's disease.
Hi, good afternoon, everyone. It is so good to see you all today. I've been at our Care Partner Corner table for most of the day, and so I've got a chance to talk to some of you guys and see how the day has been going. And I'm so grateful that you're all here and giving us your energy because you guys are the reason we do this. So, I wanted to talk to you a little bit about some of what I do. So, I am a health psychologist, which means that I work with people who have chronic health conditions, learn how to live as best as possible. So, you guys are learning about all kinds of different things today that you can do for yourselves to empower your ability to manage your Parkinson's, right? And so I want to talk a little bit about some of the emotional aspects of Parkinson's that you may come into contact with in the future, may have already come into contact with through your own experience, or maybe have heard from others. So we're going to talk a little bit about what can be typical with Parkinson's, because a lot of times when I meet with people one-on-one, they may say, gosh, is it just me who feels this way? Or is it just me who goes through this? And typically my answer is absolutely not. Everyone has experiences like you do. And so it helps to normalize it and to talk about it. So that's kind of my goal for our time today. So often when I'm meeting with people about their ability to cope with Parkinson's, we talk about identity and how that changes as a result of being diagnosed with Parkinson's. And for many people, there's this almost like BCAD kind of distinction of before Parkinson's and then after Parkinson's. And having this comparison of what you used to be able to do or used to be able to complete quickly that now takes much longer or you need assistance with. And for many people, having that constant comparison can lead to some feelings of frustration, of anxiety, of grief, and it can be a really difficult thing to sometimes come to terms with. And for some people, especially if they're earlier in the process of Parkinson's, they have pretty mild symptoms and they're like, gosh, is this even what I'm dealing with? Are we for sure that what I have is Parkinson's? And so we talk about ways to work through that. So these are common questions that can often come up for folks. And so, I often will encourage people to do kind of an inventory of how has Parkinson's affected your life? And for many people, there are some pretty large ripple effects throughout a lot of different areas, some of which you may do on a day-to-day basis, and some which may only come up every once in a while. So for many people, they report difficulty with their energy level, with their ability to do any type of work if they're still working, their ability to engage in hobbies, their abilities to connect with their loved ones and their family, their ability to go out with friends, sleep, that's a big one. We could have a whole conversation about sleep in and of itself. But it also can sometimes undermine people's general confidence. We assume, hey, if I tell my body to do something, it's going to do it. But with Parkinson's, we don't always have that one-to-one comparison. It's not, oh, if I ask my body to do this, it will do it. It's maybe it'll do it, and sometimes it won't do it, and sometimes it may do something a little too much. And so with that comes sometimes some more anxiety and some more distrust of even yourself and what you're capable of. So that can sometimes inhibit future plans because people don't know a year from now, 5 years from now, what can I commit to or what can I work toward? So that can be a really challenging set of circumstances. So a lot of times when I'm working with people, we talk about ways to reconcile a new identity. You may not be able to be the 1.0 version of who you were prior to Parkinson's. And then sometimes when you are first diagnosed and getting used to symptoms, it's the 2.0 version, as we say. And you're getting to know yourself with this condition. But then the 3.0 version is saying, hey, things may look different, but how can I work with that as best as possible and still have a good quality of life and the best life that I possibly can? And so, how do we accept that as reality? How do we cope with some of the really strong, frustrating emotions that can come along with Parkinson's? And how can I focus on the things that I can do versus the things that I can't do or are limited by? And it's not that we ignore those things necessarily, but we kind of have to find a balance of both. So, in some situations, I end up having a lot of conversations with people about their relationships. And it may be relationships that they have with their partner, it may be with their adult children, it may be with their friends or work colleagues or whomever else. But a lot of times there can be some challenges around maybe family not always fully understanding what it's like for the person with Parkinson's and the emotional repercussions of that, but then also sometimes family almost being overly helpful and they want to do everything for you, even the things that you can do for yourself. And so, how do we strike the balance between enough support so that you know that people have your back, but not so much that you feel like they're taking everything under, their wings instead? And so, a lot of times that involves some clear and sometimes very direct communication with loved ones and what that needs to look like. And also being direct about concerns or fears that you have as the person who's dealing with Parkinson's, but then also the concerns from loved ones about what they're worried about. Because sometimes we end up trying to protect people from those strong, sometimes negative feelings because we don't want to burden them. We don't want them to have anything else to worry about. And that happens on both sides of the fence for the folks with Parkinson's as well as the people that care about them. And as a result, no one ends up talking about some of the things that really matter, including some of this hard stuff. Sleep can be a big issue with Parkinson's, and there are various things that can happen with this. So again, there was a talk this morning that discussed sleep in detail, but certainly I would just reiterate that if you guys are noticing trouble with sleep, so whether that is trouble falling asleep, trouble staying asleep, having frequent nighttime bathroom breaks that are required, or sometimes people will have something called REM behavior disorder. So usually during rapid eye movement sleep, that's a stage of sleep that we all have when we dream. Sometimes with Parkinson's, we end up acting things out or doing things or saying things that maybe you may be dreaming about. And so people end up thrashing around a bit. Sometimes they end up unintentionally striking whoever their bed partner is, or speaking or yelling. And so if these are things that you are noticing, it's not just something to say, oh, that's just what it is, I'll just deal with it. Make sure that you let your neurologist know, because these are things that sometimes can be actively addressed so that you can get the best sleep possible. Because I have a feeling for some of you, you may have noticed that if you get a bad night's sleep, it's sometimes not a great day the next day, especially when it comes to some of your Parkinson's symptoms and your energy. So definitely let your medical provider know so that they can help figure out ways that you can manage this through medication or a sleep study or a device or possibly behavioral intervention that we do for things like insomnia. So we're going to talk a little bit about some of the mood issues that can come up with Parkinson's. So one thing that we know is that depression can be a fairly prevalent issue. And for some people, it's a very mild kind of depression. For other people, it can get pretty significant and really difficult. And so, we know that can happen in up to 40 or even sometimes 50% of individuals with Parkinson's. And sometimes with Parkinson's, it may not look like what you would normally expect depression to look like. Depression isn't necessarily always being tearful or boohoo and down. Sometimes depression looks really irritable and prickly and a lot of times very withdrawn, and people don't do as much with their loved ones or engaged in hobbies because they just may not feel as interested in it or derive as much joy from it. And so those are things to kind of be on the lookout for. And it's not to say that we then try to answer everything with a medication. It's sometimes medication is a good option. Sometimes talk therapy is a good option. Sometimes social support groups for Parkinson's are a good option. Sometimes just having more candid conversations with your loved ones about what's going on is also an option. So it's not necessarily that it's a one-size-fits-all scenario, but just to at least acknowledge that these symptoms can exist and may very well exist for half of this room at least at some point in their Parkinson's journey, and then being able to get the right help to manage it. Apathy is a slightly separate construct from pure depression, so I do want to differentiate that real quick. So apathy is again a very common symptom that people can experience with Parkinson's and can come without any other symptoms of depression, but it's that people just don't seem to have very much get up and go. They may lack, that sense of drive or motivation or initiative, and they just are kind of like, I'm not sad, but I'm not happy. I'm just kind of here. And their day may be spent in long stretches in sedentary behavior. And so, this can sometimes present completely separate from depression in and of itself. So just wanted to make that clarification. So when I talk to people about ways to manage depression, we talk about, how to utilize social support. Again, the more you corral the people who care about you to support you in the ways that matter, the better off you will be. This is not a time to stay strong and silent and gut through. That rarely works out to anyone's advantage, as much as we would like to think it would. And sometimes we do a little bit of what's called behavioral activation, and that is, in essence, try to say yes to doing things when your gut tells you you just want to say no. And the idea here is that oftentimes after we grease the wheel a little bit, it's easier to turn it, right? And so if you say yes and you start to do an activity, once you start into it and you go to this event, like today, maybe you didn't want to get up this morning and come here, but now that you're here, you're glad that you came and you're learning so much great information. And so, sometimes say yes instead of saying the knee-jerk reaction of no. And exercise, we know, is incredibly, to me, it's one of the best natural ways of managing depression symptoms. That's why every other session we have you in this room next, down the hall so that you can engage in some sort of exercise. One, to keep you up and energized and, good for the day, but to realize that these are things that you can be doing at home that can help keep you at an elevated mood. Because the more we move, not only is that helpful for Parkinson's, but it helps you to get some endorphins running through your blood too. And, one thing is evaluating your lens. So this is something, if you ever hear the term cognitive behavioral therapy, that's what this is evaluating how am I looking at this situation? Am I seeing it as something that's all bad? Am I seeing the full scope of what this entails? Or am I just hanging on to the parts that I feel weighed down by? And how can I even my perspective a little bit? So then, a little bit about anxiety. So anxiety, again, it can affect up to half of individuals who have Parkinson's, and we see all kinds of anxiety. We see where people are like, I get nervous about things I never would have gotten nervous about before, and I don't know why I'm all of a sudden getting nervous about them now. I've done them 1,000 times, yet here I am feeling worried about it. Or off anxiety. So for those of you who take Parkinson's medication several times a day, some people do notice some anxiety and feeling antsy as their medication is wearing off. So we call that off-state anxiety. And sometimes that can come and go throughout the day, or it's more prevalent at 1 or 2 times during the day. Some people get panic attacks where just all of a sudden out of nowhere, you feel kind of like you're dying. It feels like you're having a heart attack, but it kind of comes on real swift, lasts for a few minutes, and then dissipates. And then some people get what we call social anxiety, where they do get more nervous about going out and being in crowds or around other people. And some of that is because I have trouble, trusting my body. I don't know what the terrain of this place is going to look like. I don't know where the exits are going to be. I don't know how many people are going to be there with, kids darting in and out in front of me. I get nervous about being in social scenarios as a result. So, a few signs of anxiety may be that what I call the hamster wheel, which is that ruminative worry. You think about things over and over and over again. Avoidance behaviors. Anxiety loves avoidance. The more you avoid things, the more you think you're going to avoid catastrophe, even if the thing you're avoiding may actually turn out just fine. Anticipatory dread, like, oh my gosh, if I do this thing, how bad is it going to be? And then poor sleep because that hamster wheel isn't stopping when you try to rest. So a few anxiety management strategies. One thing is keeping a present focus, trying to keep both feet and your mind in the here and now. Anxiety loves to live in the future and just, says, what if this happens? What if that happens? What if all these terrible things come to pass? Even though 99% of the time, they're probably not going to. Or it likes to live in the past and say, gosh, all of these things that I did, could I have done them better? Should I have done them differently? And so it's the woulda, coulda, shouldas. And so as a result, if we can try to keep our mind a bit more in the present where we have the most control, anxiety tends to wither quite a bit. And avoiding judgmental evaluations. So the more you should yourself, there's a famous psychologist, and I love this, and he used to say, you should and you should, you end up shooting all over yourself. Because ultimately, you end up putting yourself between a rock and a hard place. And so the more you can avoid some of those judgmental statements, the better off you can manage the situation without anxiety interjecting. And then attempting activities with the caveat that they are safe activities. I'm not saying, hey, let's get up on a 20-foot ladder when balance is an issue. That's safe anxiety. That's a good thing to be worried about for most people. But, attempting other activities even when there's fear. So like coming here today, for some people, there may have been some fear about coming out and being here. But then once they're here, again, it feels better because now it's known instead of unknown. And just realizing that the more you feed into listening to that anxiety, the more it's able to turn the volume knob up. So the more we can focus on maybe what our loved ones are saying that may be a little bit more grounded or a little bit more practical, that may actually work to our benefit so that we don't end up turning the dial on anxiety and what it tells us. So some stress management strategies, and this goes along for depression, anxiety, as well as just general coping for Parkinson's. So we do something called pleasant activity scheduling. And this is literally exactly how it sounds, where you purposefully schedule things in your day or your week that you can look forward to. Sometimes it ends up being all work and no play, and that ends up making everyone feel very, very dull. So we need to incorporate things that provide us a sense of interest, a sense of joy, a sense of intrigue, so that our lives can remain somewhat mixed in the balance. Again, physical activity, cannot stress that enough. Diaphragmatic breathing. We carry our lungs with us wherever we go, luckily, right? So as a result, we can always regulate our breath. And so diaphragmatic breathing is basically a fancy way of saying belly breathing. So taking nice deep breaths in, so where our belly expands, and then deep breaths out and allowing our bellies to contract. It helps to lower our heart rate if it's high. It helps us to regulate stress hormones, and it helps our brain to think more clearly. So when in doubt, take a couple deep breaths. It sounds cliche, but it's a cliche for an absolute valid reason. Progressive muscle relaxation. For some people, they feel very tense, and so we do exercises that you systematically tense and then release different muscle groups of the body. Guided imagery, that's literally go to your happy place. It might be, a cabin in the woods somewhere. It might be the beach. But sometimes placing ourselves in that scenario actually helps our body to physiologically calm down. And then mindfulness, and I could keep you here all afternoon talking about mindfulness because it's a special area of interest of mine. But mindfulness is basically, how do I stay in the present moment without that pesky judgment so that I can enjoy what's in front of me and not let the past and the future dictate my life? So if you're ever interested in learning more about mindfulness, come find me and I will talk your ear off all afternoon. Activity pacing is another thing that often comes up when I'm talking to patients. So a lot of times, if you're having a good day, you are going to make the best of it. You're going to do everything you possibly can. And in fact, that ends up not working out too well because then oftentimes the next day, you're paying for it. And so activity pacing is finding the balance between not overdoing on good days, but maybe not underdoing on bad days. So instead of this kind of pacing from day to day, maybe it's, a little more like this. So I tell people, be the tortoise, not the hare, because we both know who wins the race, right? Yeah. So the tortoise, for any of you who don't know that story. And then for those of you in the audience who are care partners, we know that your mental health is important too. And so just recognizing that there are emotional, components to this journey as the person who's supporting their loved one with Parkinson's. Can be issues that develop with your own mood, with stress and anxiety, life adjustments. And often these issues get underreported because, well, they're the one with Parkinson's, so it needs to be all about them. And I'm here to tell you that that is absolutely not the case, because if you want to be the best care partner possible to your loved one, you absolutely have to also take care of yourself. It's not a race. It's not a comparison of suffering. It's that you both need support and you both need to take care of yourselves in this process. And so recognizing that there are a lot of things that you may be doing for yourself that's on this list, but maybe there's a few on here that you're not doing that perhaps you can take, away from today saying, I'm going to make sure I have my water bottle with me a little bit more often. I'm going to make sure that the next time someone offers some help in some way, shape, or form, maybe I'll say yes this time and see how it feels to do so. So think about some of the things that you may need for yourself that would be important to maybe keep on the radar a little bit more over the next few weeks. And, if you're really interested in learning more about how to care for yourselves as care partners, we will be having our Care Partner You Symposium up in Independence on October 7th. And that is something that we have done since 2019, and we're so excited to be back in person this year for the first time since 2019. And so if you are interested in joining, we do have flyers for this at our Care Partner Corner table. So I think I made my time. Yes, I did. I did it. I so rarely do. So thank you guys so much for having me. I will be here the rest of the day, and I will be part of one of our Q&A panels later this afternoon. Please feel free to find me or come to our panel. So thank you so very, very much.